All right, can everybody hear me? Good, thank you. So we have a quorum, Stephanie, I see you up there. So what we're gonna do is start the Board of Health meeting that was pushed from last Wednesday to this Wednesday, the 13th to the 20th. And I'd like to call the meeting to order. I can't remember, were there any previous minutes?
Yes.
Okay, I didn't get it, and so we can't approve those because I didn't get the chance to read and edit them or whatever the case may be. So can we have that the next meeting? Is that possible? Is that okay with?
Yes.
I sent the minutes earlier, like a while ago, like a week
Okay.
after the meeting.
Yeah, she sent them right away. They were excellent and I communicated with her, so I'm not sure what happened.
I don't know, but if it's gonna happen, it's gonna happen to me. I know that, so. We'll review them and we'll move them forward, obviously. So after saying that, let's start with the director's report, please.
All right, so Dr. Sturz has called the meeting to order on October 20th. We are located at 18 Mulberry Street, and we do have members participating via Zoom. The meeting ID is 899-0333-2659, and the passcode is 928329. And if people want to call in, they can call in using a mobile number, which is 1-646-876-9923. And if anyone has any problems accessing the meeting, they can call 603-821-2049. And Dr. Sturz, I'll just start off by reading our mission, which is to promote, protect, and preserve the health and well-being of the greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values: integrity, leadership, adaptability, and respect. And for my report, I'll just go through some of the highlights here. I did include a situational update, and it should look like this. It's probably on the bottom.
Unless maybe I stapled it to this guy.
Okay, did you give them copies?
That's okay.
Okay,
Do your
I'll
thing.
make sure that you get
Yeah, please.
And so I start out with the situational update just again for our awareness of what's happening with COVID. So globally, we're at 241.6 million cases with 4.9 million deaths. In the United States, we're up to 45 million cases and 728,000 deaths. In New Hampshire, we still see a consistent rising of cases. We have 341 cases for October 19th. 547 cases have been reported over a 7-day period, and that's a 2% increase over what we have been seeing. And we've been hoping that we would get to that stabilization, where at one point we did see a decrease in our number of cases, but we've been having a steady increase over a period of time. We've had a total of 130,040 cases, which is now representing about 10% of the state's population. We currently have 4,232 active cases, and the percent positivity rate for our state right now is at 6.3%. There's been an average of 9,170 average tests per day. So the testing has gone up and our percent positivity has gone up. We are still in substantial spread in several of the counties in our state, Hillsborough County being one of those. We've had a total of 1,532 deaths, and so we've had an increase in the number of deaths over the past couple of months. I believe there were 8 most recently. I looked at some data. I provide an update for the schools, and over a 2-week period, I saw 25 deaths in the state. Right now, we have 198 hospitalized, this is the highest number that we've had in several months. And that is impacting our hospitals because not only are they dealing with COVID, but they're also dealing with other illnesses, injuries, and other conditions, which we've been hearing from our hospital partners about the impact of this, not just here in Nashua, but also across the state. And with the decrease in staffing, you're running into issues with that as well. I believe that Flavia is going to give the Nashua numbers. I do have them in here as well, but when she gives her report from Kim's side, so she can give those numbers.
Bobby, one question before I forget. You said there was a steady increase over time. What's the time? What is that time factor?
So
Days, weeks?
so no, it's been over, I want to say at least a month now we've seen an increase. So we were seeing, most of the country had gotten to a point where they had stabilized. So they weren't seeing a decrease, they weren't seeing an increase, it was sort of flatlining and stable. We were hoping to see that in New Hampshire as well. And it looked like for about a week, our test positivity rate actually had dropped down below 5 for a little while. And then it just started to go back up. And so I would say at least for the past, I want to say at least a couple of weeks, we've seen an increase.
Do we have any idea what is causing that? Is there something to put fingers on?
So, and again, when Flavia or Community Health gives their update, what we're seeing is, it's across all of the demographic ages, but we have an increase in the number of kids, of course, that are not vaccinated. So we have a number of cluster outbreaks that we're seeing in the schools. So you're starting to see that number go up. So that's an attributable factor. And then it's just, it's this fall season, right? And so we're going to, just like we did last year, we're going to see the cases go up. We still have, I think we're up to almost 60% of individuals with at least one dose in our state. Probably we're still at about 54.9 with those that are fully vaccinated. So that vaccination rate is still low. We have the lowest vaccination rate out of all of the New England states. And so you've got that factoring in there as well. You still have the Delta variant being the major variant, and that's a very highly contagious variant. So you've got a number of factors. We don't have a statewide mask mandate any longer. We are strongly recommending that folks wear masks. You will see people with masks, but you'll see quite a few folks without masks. So you add all of those things in there together. There's not that much social distancing going on. So if the COVID fatigue, the mask fatigue, the let's get back to normal, sentiment is there. And without the understanding that we are still not out of this pandemic. And so we'll probably end up seeing an increase in numbers, especially since we have, the holidays coming up November, December. So that's a thing that we should consider as a factor.
Yeah, I was thinking of the holidays myself. Is there any way we can get a push to 70%? Is that doable? Is that reachable?
Well, you've got to have the will, right? So we do know that the vaccines, and again, this will probably be in part of community health update, with the approval of vaccine for 5 to 11-year-olds. We're still waiting for the guidance to come down. Once that comes down, we'll be able to open up and start getting that population group vaccinated. And probably from Nicole's report, she's going to talk about like what we're doing to promote vaccination.
I don't want to steal the thunder.
Yeah.
I do know, I've been hearing from friends that their physicians have been recommending them getting the booster if they're over 65. These are friends who are over 65, obviously. And so our medical community is trying to get, that more at-risk group the booster. I guess we'll wait for Nicole on that, but I'd like to see us push this, give a goal of hitting 70%.
Yeah.
If we're stuck in 50s, I think it's a doable thing, but I'm not sure what the nuts and bolts would be, how to build that machine.
Yeah, it's the will, right? So it's the will and just the continuation of reinforcing the importance of the vaccine coming from everyone, healthcare providers. There's some things that we have been working on to increase vaccination, primary vaccination in some of our population groups that still haven't even gotten their primary series done. We also want people to complete the vaccine series. So we have and anecdotally we've been hearing that people want their boosters, but we still have folks that still have not gotten their primary series covered. And so community health will talk a little bit about that.
Thank you.
Tony,
Yes,
so this is Stephanie Wolf Rosenblum. I would like to have an opportunity to address the issue of boosters and the latest data reviewed by the FDA and the CDC and the impending recommendations in a comprehensive fashion once we hear from the other members of the public health department, what they're already doing. And then maybe we can use that as a launch point of how to get more people vaccinated and how to promote the boosters and the new information. Would that be possible sort of towards the end?
yes. Well, it doesn't have to be at the end, but absolutely. Why don't we, you're on the list. Why don't we go ahead and find out what the department's doing, like you were saying, and then have you tie into that right afterwards. Is that okay?
That'd be great.
Okay, thanks, Steph.
All right.
Okay.
Financial update. So I did want to share, and you've probably heard already, the executive council rejected $27 million that was awarded to the state to support vaccination efforts. And as a result of that, it has impacted us here in Nashua. We were expecting to get some additional COVID immunization funds. That contract is no longer going to be able to be fulfilled. That would have been $50,000 for this fiscal year and $5,000 for 23 and $5,000 for 24. So
Can you give a reason why?
the executive council, they felt that it was really tied to vaccine mandates, and they didn't want the state of New Hampshire to be beholden to the federal government's mandates on vaccination.
The restraint.
Exactly. The funding, however, about 4.2 million of that would have been to allow for us to continue with the efforts that we have with getting 5 to 11-year-olds vaccinated, boosters vaccinated. So those resources would have been covered in some of those dollars. And so we're looking at other ways of seeing how we can get, those dollars in. But for right now, we'll continue all our efforts with what we do have. And then hopefully the state will work on outside of, that barrier, seeing how we can get dollars in the places that we need to be able to move forward with some of these. We were awarded $25,000 to the United Way for marketing for adverse childhood experiences and early childhood prevention efforts. And so that will be coming soon. And we were also awarded $8,000 for a 988 campaign for substance use disorder. And that's a communication campaign so that if individuals are having problems, they're going to have a whole resource connection set up for folks to call a 988 number. And these will be implemented under Lisa Vasquez, which is our substance misuse prevention coordinator and our behavioral health strategist. So we'll be looking for those funds to come in. I did include or put back in the policy update, and Fokia has printed, it's 44 pages long. So each of the managers has gone through and identified policy that we need to, or LSRs that we will need to focus on. And so I'll have them just talk about a few of them because it's way too many. I started to go through the list. I put just a few bullets on here. There's so many of them. Some of these are going to be inexpedient to, you're not going to be able to do anything with them, but some of them we're going to have to pay attention to and may have to call some of our legislators. So I just have some on this list here. Okay, can you make that so that it's only one page so that that list is a little bit bigger and all on one page instead of splitting between two? And so those bullets are listed there. So there are some that are relative to requiring COVID vaccination for school attendance, allowing the public meetings to be conducted virtually. So this has really, when we were in COVID, we were able to have virtual meetings, and the state has stopped that. So now you have to meet in person. If you don't have a quorum, you can't hold the meeting. That's causing a little bit of a problem for getting certain things done, because if you can't have a quorum, you can't vote. Right. And so right now there's some things that are being impacted by that. So We did really well as a state with virtual meetings because then you had people, you had representation from co-op all the way down here at meetings. You had a very open democratic process that could take place. Now it's changed. So that's one of the bills that's on there. Relative to opioid abatement trust fund, that's on there, and I have some information about that because the city of Nashua did sue, and a settlement was awarded to Nashua, so there'll be some millions of dollars that'll be coming in over the next 8 to 18 years that will be specifically focused on opioid abatement. So prevention, treatment, recovery services will be getting certain amounts of money, and we've gotten, I believe we've gotten either $24,000 or $27,000 already that we have to distribute in the community for that. But this is also on here. Prohibiting coercion or punishment for refusing or failing to obtain medical treatment or vaccination. So there's going to be a lot of LSRs or attention paid to vaccines. There's one that's relative to the rights of the conscientious for medical professionals. And when we've seen this language in here, it was, for people not to get vaccinated. We usually see this come up with a childhood vaccination, so that concept, rights of conscience or whatever. And that has not passed in a number of years, so we'll see what happens with that. There's legislation in here relative to legislative oversight of the emergency powers of the HHS. So that would impact whether or not they could call an emergency, event. So some of those powers were taken away from the governor to be able to say this is an emergency event for the state. So we have different types of legislation. So I did ask for Kia to print this off. She has an updated list, and you guys will each get one. And Stephanie, we will make sure that we email you a copy as well. So again, some of these will be inexpedient to legislate, and others will have to pay attention to. All right, operational updates. We continue to, the managers and I continue to lead and support our staff and are working with our community partners as key public health strategists to perform the core functions of public health to make sure that we address the issues that are needed to protect and preserve the health of not just Nashua, but the greater Nashua region. And we continue with our daily operations, as you will hear from the reports from each of the managers that will be presenting this morning. We are moving more towards recovery efforts. The state is moving more towards recovery efforts, so you'll hear about some changes in how disease investigation is being done, and with a major focus again on vaccinations. We are also moving forward with our reaccreditation priorities, and Ren will talk about that. He is the lead for that for this year with the backup from Iraida Munez, who's in the welfare department. And then we have some staffing updates. And so this is exciting for us because it allows for us, again, to have the workforce needed to do what we need to do. Our CDC Public Health Associate is here. Oh, you know what? Mackenzie should probably be in here too, guys, can meet her. I'll grab her when we move to the next person's report.
Okay.
But Mackenzie, her name is French Barriere.
It's Barrier. I'm on the call, Bobby.
Hi, Mackenzie.
Nice to meet everybody.
Welcome.
So she will be with us, and I practice that. I had her even tell me, how to say that. Mackenzie will be with us for the next 2 years, and she'll be working on the community health improvement plan and process, and she'll also work with us on reaccreditation and other things. The CDC has the associates assigned to each health department to be a part of the health department, but they're CDC employees. So she'll be with us for the next 2 years. We did find a candidate for our public health emergency preparedness coordinator slot. And so Patrick Henry will be joining us on October 26th. And we're very excited to have him come on board. Background checks are in process right now. And so once those are completed, if those pass, then we'll have Henry on board with us, Patrick on board with us the last week in October. There are some additional positions that are coming through the funding that we received through the Enhanced Detection Grant. So we've been able to bring on an administrative assistant support. Mara Santos Lazard, she was working with us as a COVID support person. She decided to join public health full time. So she was excited about that opportunity. And she'll be starting on November 1st. And we're interviewing a behavioral health specialist that will help Lisa with some of the work that we're doing under the SUD and behavioral health things. Community health, and Kim will give a more detailed update on this. It's going to be bringing in some staff because we have a CDC workforce grant that we're expected to have the contracts in place hopefully by December. And we're expecting to receive some additional funding through other dollars that have come in so we can bring on board a full-time chief health equity officer, because a lot of the work around the core functions of public health and services now have a huge equity lens, which we've always had, and we want to bring a person on that will allow for us to continue that work with a great deal of intentionality. We have a New England medical student that will be joining us next week. Her name is Julia. She likes to be called Maeve. She'll be starting on the 25th, and she'll be with us for 2 weeks. And then our staff continue to do trainings. We have a DEI, diversity, equity, and inclusion workforce development session that we have 2 more sessions to go. And we're also doing some trainings around homelessness populations and some HIV treatment as well. And then the rest of the report just has some of the boards and committees and commissions that I sit on and that I've attended during this month. Other highlights, you are getting the staff, the directors mentionables. The managers will send some highlights of what things are happening in their departments with their staff. You guys have engaged those. So congratulations to our staff for the different achievements and working and doing other things. And then I've been invited to present at the New Hampshire Hospital Association annual meeting. It was supposed to be face-to-face, but that has to get canceled because of the substantial spread. So now it's spread out 2 weeks over a virtual conference. And so it's been pretty good. Are you attending it? No. Oh, it's been really good. And I was also invited to present at our Emerging Leaders for Public Health monthly meeting next month to share our story and what we've been doing with COVID as Chief Public Health Strategist. And then finally, we have 3 APH presentations over the next 2 weeks. Again, I think they've done it hybrid, so it's virtual and in place. So Nicole, our health promotions and communication specialist, will be presenting. Katie Hatcher, one of our public health nurses, will be presenting, and Jane Goodman will be presenting as well. Any questions on that report?
Comprehensive. Impressive.
Stephanie here. A couple of quick things, if I might. First of all, an amazing body of work, and good luck with your presentations. It certainly is good for them, but also a good publicity for us, for people to know what we're doing. Relative to some of the things you've touched on, one is the legislation. Thank you. It's great. We should see when the different things come up, but I feel compelled to comment on the science of one of them. I know we're the Nashua Board of Health, but because the Board of Aldermen and the mayor look to us to interpret and bring forth the science of what we know now, and we're going to talk more about vaccinations and boosters. I don't want to speak for the entire board without their weighing in, but having the availability of remote participation in meetings is critical for the democratic process, for all participants to be able, and I'd like to go on record for that. And again, I don't want to speak for everyone, but it would be my preference to communicate that in our minutes. Are you guys good with that?
Yes, yeah.
Tony, Chuck?
Yes.
The second thing is, I am very sad to see the events unfold with the Executive Council, and that at their rescheduled meeting, the first one having had to be shut down due to the lack of civil dialogue. I'm very sad to hear that those critical funds were declined. I'm equally as concerned about the misinformation and relative to the science of what the vaccinations are meant to do and where mandates do and do not exist. There are no state mandates for vaccination, and there are federal mandates, and it is unlinked from those funds. And I just want to make sure that we are providing correct information. And then lastly, Bobby, I want to ask you if the change in leadership at Southern New Hampshire Health has led to any disruptions in communication.
No, and in fact, the changes that have occurred over at Southern have actually enhanced communication, has boosted
Great.
morale, and has brought on a great deal of hope for all of the staff across all levels at the organization. So it's been a positive change that has occurred. You know, which, and I serve on that board, which the board is now very well pleased, as well as all of the staff at the hospital.
Okay, great. That's great information. Thank you.
That's it. You good, Stephanie? Okay, thanks. Bobby, who's next on our batting order?
Community health. And I see that Kim is here as well as Flavia. So Kim will decide how they'll push out the situational update, and then she'll provide the majority of the information for community health department. Thank you, Kim.
Hi, good afternoon. So you have the report with our reporting for the month of September. A few things that I want to talk about that have gone on currently and will be planning in the future. So we continue with our vaccination strategies, and our priority is on the unvaccinated. So that includes adults, and then we are gearing up, trying to figure out our strategy moving forward with vaccinating those that are 5 to 11 once that is approved. And we will share those plans with you as soon as they are finalized. We've also been coordinating and started our flu vaccination clinics in September and continuing into October, November with our school district, and as well as in our clinics and our outreach activities, as well with some partners around the Nashua area. We continue to have full clinics in-house for our immunizations and STD clinics. We've been very busy. We, as Bobby stated, will be hiring a few different positions. One of them will be a part-time public health nurse who will be half-time, and these are all grant funded. And the other is going to be a DIS, a disease intervention specialist / behavioral health public health nurse. So that person will be able to prioritize clients with key risk behaviors in focusing in on disease investigation. And the other thing is just to note, as of October 1st, the state, for the New Hampshire DHHS directive, we have stopped investigating all individual cases in New Hampshire of COVID-19. We are still following those clusters and outbreaks. And our school district has been working very closely with us as far as letting us know about any children that have COVID in the school systems, and we do track that. And lastly, I just wanted to mention that starting in November, we'll be expanding our STD clinic and immunization clinics on Wednesday mornings. We'll be doing a 2-hour clinic from 10 to 12, and that will start November 3rd. So that's just because we are so busy in our clinics, and we want to be able to not turn anyone away and see anyone that needs to come see us. And that's it. Any questions at all?
Thank you, Kim. Any questions?
You're welcome.
Kim, will Flavia be able to give the situation update on the COVID numbers for Nashua?
No, she's at, I think she's listening in, but she's actually at a clinic. She's on her way to Brookline right now.
So I can just give those numbers really quickly. I have left those But I can do that really quickly.
Okay, thank you.
Okay, in Nashua, we are currently at 390.4 cases per 100,000, which puts us at substantial spread. Nashua has had a total of 9,704 cases. We have currently 194 active cases, and our positivity rate is at 6.6%. We've had 350 new cases in the past 14-day period. We have had 98 deaths, so there is one new death that's in here since the last time I gave these numbers to the school, and 190 hospitalized, and again, that number is up from the last time I gave an update to the school, which was on Monday. So we are seeing increases. And Tony, you asked like where, so there are quite a few clusters statewide in the schools. When we look on our state's website, the numbers for Nashua's schools is not updated, and so that information is not as accurate as it can be, and it has to do with like the timing and when they actually get the reports. But we have had a number of cluster outbreaks here, and I believe that Flava reported out for us. I don't have that for that we've been able to close at least one cluster outbreak, and we have cases in the school that aren't like clusters, because that's one case that's being reported. So all of that information is going to be as best as what's being reported. So for the most part, our numbers are probably greatly underreported across the state and in our city. But with this that we do have, we're at substantial spread.
Mm-hmm. Thank you. Any questions, Stephanie? I think she's shaking her head no. I'm not sure. Anyway, so Flavia will be able to give it. Who do you have after?
We have community services with a couple of different reports. So for the EPI, that situational update was a part of that. We still have that position open. We do and are hiring Angela Constantino as an EPI consultant, so she will still be with us here at the division, supporting some of our EPI work. And then the other report is going to come from Nicole.
Nicole, can you give your report, and then we'll have Stephanie jump in after Nicole. Is that good for you, Steph?
Sounds good.
Okay.
Hi, everyone. So I'll just do some high-level updates. I have everything else listed in my report. So I've been continuing to work with the community health workers, by giving them data and resources that they're able to use out in the community. We've also updated our COVID-19 brochures with the latest information, thanks to Flavia. So those were reprinted, and they've also been giving those out within the community, which are a great resource. We do have another billboard to promote COVID prevention, so masking up and getting vaccinated as we get into the holiday season. And this will actually go out in Milford, and it'll run from November to February. And if you have walked down Main Street, you might have also seen our scarecrow that we have decorated for the Great American Downtown Scarecrow Contest. So that's up for the next few weeks, and we've decorated him to promote flu and COVID-19 vaccines and masking up. And I did want to mention too, in regards to the boosters, we have been pushing information from the FDA and the CDC. And I'm interested, Stephanie, to hear what you have to say as well. We're always trying to get out the latest information. But as Kim said as well, we are focusing on the unvaccinated. And then lastly, for COVID, we did schedule a listening session with Dr. Marie Ramos, and that's going to be on October 27th. Via Zoom, and we are just using that as an informational session and kind of a conversation with our community to learn their concerns about the COVID vaccine. So we're inviting people who are vaccinated, people who are not vaccinated to come and just talk to us so we're able to answer questions and kind of adjust our vaccine communication strategies. In addition, we also have a billboard going up from November to February focusing on HIV testing, as well as one for the flu vaccine. And one of those will be in Nashua, as well as one in Mack. You can actually see the artwork for those at the bottom of that page. We've also been working really hard. I've been working with the community health team to promote flu vaccination this flu season. So we did recently put out a press release to promote where people can get the vaccine, including our clinic hours. And we do have an ad that ran in the local Hippo newspaper as a print ad, and that runs throughout the region. Other than that, we have been continuing to attend a few events. So we did attend the Wheels and Wings event in Nashua on September 25th. We had one of our bilingual outreach workers and our community health worker go. They gave tours of our mobile van so people could see the services that we offer. And they were able to sign, I believe, some people up for our clinics. And then we also attended the United Way Community Baby Shower on October 5th. That was a great event. I know that our nurses were able to administer 9 COVID vaccines, and they were also able to sign folks up for our clinics here at 18 Mulberry Street. And we gave away a lot of information for expecting parents and families with young children at that event. Other than that, Bobby and I did submit the Public Health Network lead grant. That final report was due at the end of September, and we did present on our completed work plan activities as well. So that lead grant is closed out. And then just some things that are upcoming for our radar. We are promoting Drug Take Back Day, which is this Saturday. And there are locations throughout the region that people can bring their prescription drugs, their expired, unused, and unwanted prescription drugs to get rid of safely. We do have Red Ribbon Week next week, as well as Lead Poisoning Prevention Week. And I am focusing a little bit on getting some information out for Halloween as well. And I think that's overall.
And Tony, if I
You
may.
said that all in one breath. That's
You
pretty
did.
impressive.
We are very competitive. So as you can see, we have a scarecrow on one of the light posts up Main Street. There are many other scarecrows. So if you go on and click, you can vote every single day until, I believe, is it the 30th, Nicole? So everyone
Yes,
should.
I think to the end of next week.
Yeah, so we've got some competition. So we probably, I think, have about 51 votes. There's one agency that has 400 and some odd votes. So we've got to get voting.
Yeah.
You can also take a picture, and if you take a picture and send that in, you get even more, you get 5 times the amount of votes. So yeah, we're competitive.
Okay.
And we're also, you can see in that other photo there, we're all wearing pink in recognition of Breast Cancer Month. So if you wear pink, send us a picture, pink every day for the month of October.
Get pink mask.
We have some of these, you can have them.
Okay, any questions for Nicole? Great job. Thank you, Nicole. Stephanie, would you like to segue in?
Sure. Great stuff. Just a couple of thoughts. One is that the new recommendation suggests that you can give someone the flu vaccine and the COVID vaccine at the same time. I'm wondering if we're doing that. I'm just going to sort of roll my thoughts and then you could address them all. The second thing is, because of the very disheartening statistics about how dangerous COVID-19 infection is in pregnant women and how advantageous it is for them to be vaccinated, not only for them, but for their unborn children and for the newborns, including with lactation. I didn't know if you had, I know you had said you had the parents group, but if we had a special initiative to get to the pregnant population. I'm excited that you have multilingual brochures. Everything is going to change this week. I don't know if everybody has an awareness of what's going on, but the FDA, CDC, and the ACIP, the American College of Infection Practitioners, is due to come out this week with final recommendations. And it is anticipated they will look something like this. Pfizer boosters for everybody above the age of 50, maybe above the age of 40 because of the waning immunity. Moderna boosters similarly. J&J no longer should be considered to be a single series vaccine. Again, this is what is expected, but we should have an awareness of it because we're meeting now. Originally, it was approved because The threshold was supposed to be 65 or 70%, and the J&J met that, which is similar to what the flu vaccine is. But we now know that if you're going to compare it and get vaccinated, it should be a 2 series. And the studies with mix and match look like if someone who got a single J&J gets an mRNA vaccine, especially a Moderna, remember the Moderna dose was higher, so the Pfizer was 30 micrograms, Moderna 100, that they get not a 4-fold boost with a second J&J shot, but a 64-fold boost. At least that's the preliminary data that has been published. So, and of course, vaccinations for children. So, lastly, it looks like taking your flu shot also helps prevent against severe COVID, hospitalization, and death. They don't know why. If it just revs up the immune system, they haven't quite published the science on that. But I'm hoping that we can leverage all of these things to enhance our program, but be mindful that primary vaccination, when it comes to people who've received the one J&J vaccine, might be them too, as falling into the category of needing to finish their primary series. So I'm happy to answer questions, but that's the abridged version of what my read is of the science this week.
Thanks, Stephanie. Amazing, it's always changing. Chuck, any questions?
No, just anxious for
Any comments?
the 5 to 11.
Yeah,
So
yeah.
we can make that happen. It'll be great. So I think that's the untapped problem here in our community right now. Is it's just I must have called at least 10 last week positive COVID families, and a pattern in a week that I never did it 18 months prior. So so if we can get it out there and get it done and have you guys help, it would be great. So
Just for grins, how are we doing with vaccines? The regular flu vaccine.
Kim will be able to share a little insight on that. So we just did we are doing the school-based clinics. So I know that they've been giving out doses there. We have the clinics here at 18 Mulberry. We just did the City Hall Health Wellness Clinic. And so vaccine has been going out there. Kim, do you have an estimate of how many doses have been administered thus far?
For which vaccine? I couldn't quite hear. It was a little muffled.
Flu vaccine?
For flu vaccine? Mm-hmm. For September, we did 5 Nashua school clinics. We've done a lot more this month as well, but the numbers I have in front of me, 206 adults, 187 children were vaccinated for the flu at those 5 schools. We have done a whole bunch of different clinics other than those, and we have immunized, not for flu though, I'm sorry. This is just childhood vaccines and COVID. So as far as the school clinics go, that's what we've done. We had a City of Nashua employee clinic on Friday where we vaccinated 87 city employees. And I can get you other statistics if you would like.
What I'm looking for would be a comparison this year versus last year. Are we on pace to do the same? Hopefully not. Hopefully we're doing more.
Last year was a little bit of an outlier year because of COVID. So it may not look the same, but I can go back a few years and take a peek at that and let you know.
All right. Thank you. Thank you.
You're welcome.
One other thing, on the schools, do you do vaccines at the high schools?
Yeah, we've done both. Yeah, we do all the public schools and also charter schools in Nashua. I believe there's 17 or 19.
All the parochial schools.
19.
I'm good. Thank you.
You're welcome.
thank you, Kim. And I just want to acknowledge Flavia's help this week, as always, and the rest of your wonderful colleagues that I just got on Monday night this standing order for, as a school doc for the Nashua schools, to sign so that the state will supply now free in-school tests in the next few weeks, hopefully, once the shipment comes through. So the school nurse and all the 18 schools, they're also doing it at PG. I just found out yesterday already from the school nurse there, Carrie, that child comes in, may have some symptoms in the classroom, unbeknownst to mother. The teacher now can send them to the school nurse, do the test, and with 15 minutes have a yes positive, no negative, and appropriately send them home or keep them in the class. And for us on primary care in the trenches and you guys, it's a game changer because we're just inundated every day with, you know, the cough, cold, snot. Is it allergies? Is it flu? Is it COVID? And we're all stuck in the middle, and the parents sadly are stuck completely in the middle because they don't know what to do. So I thank Flavia for that, and hopefully we'll, as a result of that, I think we're going to see a lot more. The rates are going to be going up, but I think it's a good thing, so we know where our little sequestered clusters might be. Thank you.
Yeah, thank you for mentioning that. Flavia definitely was a huge part of getting that rolling and working with the schools and working with the state to get them their license. And she drew up a whole standard operating procedure and did a training with the school nurses. So she did a great job with that.
All right, Stephanie, any other questions? Nope, thank you. I'd like to move on. if
Nope.
we could. Okay. Where are we? I've lost track.
So we have a report. So Jane has transitioned into the Public Health Network Services Coordinator position and has been in that role for about a month now. And so she does have a report. Our Public Health Strategist position is open and we are interviewing for that position. But she, in her report, continues to host the Public Health Matters TV show every week with during the month of September, had our guest for the Youth Council and Lisa Vasquez promoting Red Ribbon Week and our prescription for drug take back day. She continued to work on our community health improvement plan and is the co-chair of the CHIP planning committee. And so we'll be moving forward on getting all of the data. We had surveys that went out to each of the priority focus areas. Those are in, so she's working on analyzing that data, and we will have a meeting on November 4th to present that information to our Public Health Advisory Council. She is the lead for our chronic disease work group, which is focused on diabetes, depression, and hypertension as primary focus issue areas for chronic diseases. And she continues to work on the Insight Vision software that we're using to collect all the data. So she's inputting all of that information in there, and then we'll use that to transfer that over into our live stories page on our website. She will be working with our public health associate as the host site supervisor. So she'll work with her and will be there to guide her through her time with us during the first year, and then it switches over for the next year. We do have our, we're planning for an annual meeting of our Public Health Advisory Council. You will all be invited. That will be in February. And what else do we have here? She's a co-lead with Lisa Vasquez and myself on our Kresge Foundation, which is looking at the trust issues with our BIPOC populations so that we can increase access to care and learn a little bit more about what providers may understand about some of the issues that are related to this population group. So we're waiting for our report from New Hampshire Listens, and then we'll move forward to start doing some key informed interviews. She worked with me to coordinate the tent exercise for our regional EMDs, and that went really well. That was kind of fun, yeah. And we had at least 7 of our towns come and watch us blow up a tent. I mean, not blow it up, but inflate. I should use the right term. Inflate a tent. And she's been very instrumental in our leading of getting our Gilson Road warehouse reorganized and getting our trailers that we can deploy restocked. And that's it. And she's actually right now in a 3-day ICS training, which is a requirement for our workforce. So she's doing that training right now. And next week she'll be presenting at APHA. So she's got quite a bit on her plate.
Behavioral health.
Behavioral health is a report from Lisa Vasquez. So this is her report for what work has been done with our substance misuse prevention program, as well as our substance use disorder continuum of care. So Lisa's work is really, really grounded in the community within the region. So she's working with other youth organizations. She leads our mayor's opioid task force as well. And as Nicole showed with the Take Back Day, with the pushing out of information for that, Lisa coordinated the delivery of the tools or the supplies for that down here to Nashua, and then we had our community health workers distribute all of those take back boxes to all the police departments in our region, and we've got 12 out of the 13 towns participating this year. So she's worked on that every year to increase the number of folks that are participating in that. And then the rest of her report lists out the events that she's attended. She's been doing presentations in the community, and she's on the board for Revive, so she's worked with them and helping them take care of a situation with their executive director to make sure that they had staffing there. Lisa also co-hosts the Public Health Hour on Fridays, and then on some days we'll host it alone with guests. So we've been able to keep that going on. She has, right now, she is at a meeting in Manchester on the Red Ribbon Week and the Drug Take Back Day, and she has one of our community health workers, Nellie, with her there. So that's why she's not here to give her report. Okay, any questions?
Any questions, Stephanie?
Nope.
Okay, thank you. Moving on to environmental health, Heidi and Ren. Put up the spoils.
Good afternoon. Heidi Pikakoka, Health Officer for the City of Nashua. Just want to go over our report for the past month. Food service industry still remains pretty decimated by COVID, and we were seeing that in some poor performance, lack of consistent staffing, and supply chain issues that impact what's on a menu, what's available, and what the prices are. So these guys are having a really hard time, but our focus is making sure that they're not cutting corners when it comes to food safety. We have, in recognizing the problem that this is an ongoing recovery that's going to take some time for everybody to gain some better ground, we decided that we would still not charge the reinspection fees for the rest of this calendar year. It seemed like the right thing to do. And then we'll take a critical look at that point. But would much prefer that food service owners and managers put their money back into their business, and even getting gaskets is hard for them right now for refrigeration, and things have to be ordered, and trying to just get the necessary pieces is a real challenge. So we're trying to help them in real time, thinking creatively, and again, making sure that temperatures are at appropriate levels and sanitizers are at appropriate levels, that people are washing their hands, and that the food coming in is from a sound source. So it still continues to be a challenge, and it's really our primary goal right now. Ren, do you want to add anything else to that piece?
No, Heidi, I think you summed that up perfectly. Thank you.
Heidi, I have a question.
Certainly.
Do we have a way of sharing training and knowledge gained from some of these interactions with all businesses in a way that maybe an individual business could not, due to staffing or due to the fact that they don't, they're not in a position to publicize? So for example, is there a little, hey, people are running into gasket problems and the potential solutions are rather than having things repeat themselves and making more work for you? Is there some kind of universal training that new workers could, you know, scan a QR code and go on YouTube, and it could be used waving there and telling anything that we can do to make it easier for them and you?
New Hampshire Cooperative Extension Service offers like a pre-serve safe course that is free of charge and very accessible. So that covers a lot of the basics. We're trying to pass along information as we can when we're out there in the field and we notice that they don't have any sanitizers, test strips. We typically will give those out just so, because it's critical that those dishes are being sanitized from one person to the next. We also have discussed as a department putting together some formalized trainings that are readily available for people, because we recognize that this pool of employees is, they haven't been introduced to a lot of these food safety concepts. They're coming in, they're taking the jobs because some of them are paying pretty well right now, and they have no knowledge base. So it's continuous pool of new people on a regular basis. So the ones that we've been out to for re-inspections specifically, we've offered that we will either do a Zoom training with them. We will do something that they can pull up at a later date. We haven't developed a singular model yet, but we're working toward it.
I can add
It has to be
that.
online.
Oh.
There has to be existing online that doesn't have to be recreated. Bren, please tell us.
Yeah, so you'd actually be shocked at how little there is online. We scoured everything, the resources. Usually they're kind of coveted, meaning that there's a lot of agencies that charge for this. So there's not a lot of stuff that's out there for the public to actually view. There have been some colleges that have actually posted videos. So a couple weeks ago, we kind of scoured what we could find. And we updated our website, and we put all those links to those training videos on our food service webpage. And so now when restaurants contact us, we send them that link so they can have their managers and their staff watch that.
Great.
As well as a link to, Heidi had mentioned, the cooperative extension, which is currently offering free virtual food safe handler training through their office. So that we've also been sending out to our restaurant folks.
Great, thank you.
And that's certainly the lion's share of what's been going on. That's not to say that there aren't all kinds of plans that don't come through the department and are processed. There are all kinds of people now who think that they're going to start up food service operations, and they're probably taking advantage of real estate that's now available, or the mobile vehicles that have gone up for sale as well. But it's not an easy or a decision to be made lightly. So we're doing a lot of hand holding and walking through those decisions and making sure that they're sufficiently safe. We also still, Ren's been dealing with a whole bunch of septic plans. We're still doing our institutional inspections. I know that for pre-planning board tech review, there have been an awful lot of plans that have come in. Those take a lot of time, and mosquito collections through our vendor, Dragon Mosquito, it will be coming to an end this year. Luckily, no positive mosquitoes in Nashua. We do watch the numbers throughout the state very carefully. The vendor gives us updates about her sample locations and about what they're seeing as well, and kind of what they see as a potential forecast for the upcoming year. And meetings and events, and we also have been inspecting some of the temporary events that involve food as well. Ren, is there anything else you would like to add?
Nothing in environmental, but I'll wait to see if there's any questions before. I do want to give an update, as Bobby had mentioned, to our accreditation work that we're about to amp up as we head into 2022. All right, so
Any
I'll dive.
questions from, any questions from, the doctors towards, Ren or Heidi?
Thank you. Well,
Okay, Ren, why don't you rev it up on the accreditation?
Perfect, thank you very much. So accreditation, as you know, we've kind of at the end or heading towards our 5th year, which means we have to essentially re-up that process. So we're entering into the re-accreditation phase beginning in January 2022. But that's kind of is changing for us. So the Public Health Accreditation Board, FAB, what they did is they're creating a new version. So what they're calling version 2022. And if anybody knows the 10 essential public health services, if we think back to, I believe, even our chip in our old kind of process, you see that nice colorful wheel and it has, all those pie slices. Well, that changed back in September 2020, so that there was 10 slices to that pie. And in the center of that was the central underlying concept of research. That had changed now to 2020 with a nice focus on the equity. So there's an equity underlying lens to everything that we do for public health. And that is the new focus of version 2022. So we have the option to go through our reaccreditation process under the old version or under the new version. And we did meet internally with our strategic team and had come to the conclusion that we're going to operate under the new version 2022 because we're already doing a lot of this equity focused work and everything that we do, and we really want to highlight that as we transition to this new version. So in January, they're going to release that new version. So we're not finite on what that looks like yet for what's going to be asked for us. There is a draft version out there that we're in the process of review to see what that's going to look like, but it's going to be approximately the same amount of work, just in a condensed format. So there were 12 underlying sections under the old version. It's going to be condensed into 10 in this new version, essentially one for each slice of that wheel that I mentioned, with that equity focus under each of those pie slices. So that's what we're going to be working with beginning in January, but we're going to work over the next few months at looking at what that draft version looks like, so we know what we have to prep for in the coming new year. So that's where we currently stand for that process.
How long does the process go?
Yeah, it's a great question. So it's going to take several months. So because we're entering into a new version, they're going to allow us to apply for an extension. So typically we have the entire quarter that our accreditation is due. So we would essentially be due to apply in January. So we typically would have until the end of March to complete the documentation that they're asking for. Since we're going to be entering the new version, it's going to take a little additional time to gather all of those items. We can apply for an extension. They're not saying how far that extension goes. It could be a couple months, but once we submit everything, it takes about maybe 6 to 8 weeks for them to review all of that, to formulate their feedback, to provide us with that feedback, and then we have an additional few weeks to respond to the questions or concerns that they had. So the whole process is essentially going to take most of 2022. And there's going to be a virtual site visit that goes along with that, where we will be meeting with a panel over, I think, a period of a day or two as we review each of the major sections, and they just ask us questions on everything, very similar to the in-person site visit they did back in 2017 for us. It'll just be virtual this time. So it's going to take several months for the entire process.
Thank you, Ren. Any other questions, Stephanie?
Nope.
Okay, you're good.
Good work.
Good luck. It sounds like it's going to be a lot of work, but we're behind you.
Thank you.
Bob. Okay.
Yes, good afternoon. Good afternoon, thank you. This is Bob Mack, Welfare Officer for the City of Nashua, presenting on the statistics and information for the Welfare Department for the month of September. You can see, based on the report, that we've seen a slight decrease in our expenditures compared to the same month last year. We are in a slightly different situation and circumstance as some of the moratoriums have lapsed as compared to this time last year. We are continuing to refer people to the CAP agency, Southern New Hampshire Services, for any emergency rent assistance or utility assistance that may be related to the COVID situation. So we'll continue to do that throughout the course of the year, as those that financial assistance will continue for a period of time. We've seen some slight decreases in the need to issue vouchers based on referrals to those alternative programs. We continue to work with our community partners, nonprofit organizations that have homeless prevention funds, utility assistance funds, and food resources and shelter resources in the community. We have been looking at, with the change in seasons coming upon us, we are working with our local providers, shelter providers, to see if there's any opportunity to create additional shelter space. They're still kind of operating under COVID guidance, so there's limited availability for additional shelter space, but we'll continue to do what we can do for people in need. There's been conversation about warming stations for the colder days. The public library is open, so some folks do go there throughout the day. And we do have some opportunity for some of our local organizations to have some warming spaces, and some of our faith-based organizations as well. Churches have some coffee drop-in centers and whatnot. To this point, we've spent approximately 13% of our general assistance budget, as we have just completed the first quarter of the year. So we're doing okay from a financial perspective at this point in time. We'll continue to operate under the mandate of RSA 165 in our general assistance guidelines for the city. And that's all I have. I don't know if there are any questions.
Any questions for Mr. Mack?
No.
Thank you. Comprehensive as usual, Bob. Thank you very much.
Thank you.
I have one item from the last meeting, and that was this is Stephanie, so I want to give her credit for it. Applying 2 meetings a month, emergency meeting for the board in case we need it. And in trying to be fair, balancing it out, we have kind of a 2 thought process on this. One would be, do we have the board, the emergency meeting, because the reason why we need it is because we're overflowing that day. Do we have that right away, the next day, the following Wednesday? Or should we just automatically alternate every 2 weeks? But I think it's a great idea because it gives the doctors a chance to pre-schedule out those days in case they need to be here so we can have our forum. So I'm looking for some guidance from Dr. Chuck and Dr. Stephanie. How do you want to go ahead and pre-arrange those dates so that we can release them to you so that you can do your due diligence with your staff and hospital people, et cetera? Guidance?
Well, the first thing, it would depend on the crisis, I guess.
True.
You know, I can see both sides of the coin, and then the following week we can begin and address it when the cat's hot and there's our momentum. On the other hand, I'd like to think that we, with the events of the last year, we're not hopefully go through that again anytime soon. So just my perspective on a planning perspective, for my schedule, it'd be easier to know twice a month, 2 weeks after the board meeting, with the fourth Wednesday of every month would be, just an emergency option if we need it.
Absolutely. Stephanie, your input?
So I think what we said is, because we wanted to block off our schedules and not have a situation where we needed to meet again, we didn't want to shortchange a conversation. we would already have time blocked out that we could then retrofill if not needed. So I'm hoping we don't need it, but I think it's going to be like an umbrella. If we don't schedule it, we'll need it. If we schedule it, we won't need it. One of the things that I am concerned about that we've run into in the past is that when we have something we need to propose to the Board of Aldermen, the deadline, my understanding is the Wednesday at noon before the meeting. So when we meet on the second Wednesday and the aldermen meet on the first and third Tuesday, if I have that correctly, we miss the window to get something on their agenda. My concern would be that if we continue the second and the fourth, there would continue to be a lag between the time that we could propose something and the time that it could be taken up by the Board of Aldermen. So under the category of, if we have the momentum and we want to also fulfill that need, would it be possible to schedule a 1-hour meeting the following Wednesday that obviates that extra 2-week lag? And then we would decide at the end of a first board meeting every month whether or not that was necessary or whether that time could be freed up. Thoughts?
No, that's fine too. I don't have any problem with that. I'm just thinking, we booked 6 months out, so I like the idea of having the regular one and having that, because like you just said, didn't appreciate the alderman meeting. I think we need to be in tune with them. So otherwise, as you said, the window's closed. So I like that option to make a decision at the end, put it on our agenda every week and decide as a group if there's situations, whatever they may be, merit something the following week.
I'm very, very flexible, so I'm okay with that. The thing that I would probably not like us to do is the next day, because a lot of times you need to do some homework, so some information.
Yes. Yes.
And so too many times what happens is it's more of a knee-jerk reaction than following it through, which I think we all agree, because the way we're trained, we want more information, not emotional decisions. So if I hear you both correctly, we'll keep the second Wednesday of the month as our regular board meeting and block off the following Wednesday. And I'll do my due diligence of going through and highlight if there's any holidays in the way. And we'll discuss it next time if that be so. And you want to schedule for about an hour?
Yes. The idea would be it would be very targeted.
Oh,
One topic. Key topic.
On topic, my lunch hour, unfortunately, is 11:45 to 12:45. So I would ask if I could, if I might have to make it a Zoom meeting, but I don't have time to get down here to the building. But that's the only way I could make that on a regular basis, because I can't take any more time out of the office, because I have to give back every hour that I do. So they time it like clockwork. So if I'm available, even if it was 12 to 12:45, I could do.
Well, tell me when you're available, and even if you're doing it Zoom, I'll make sure that's okay. Fine. So
Let's give it a full hour, and out of respect to Chuck's schedule, I have no problem with 11:45 to 12:45. I don't know. I'd like Jackie and Jim CTV to weigh in to see Bobby and Jim CTV recording guy to see if that works for the public health department. But I think we need to be realistic about how it's going to work for everybody's schedules.
Yeah. I think we can do that. And, exactly what Chuck said, this is an emergency meeting. This isn't something that's going to be routine. Okay, thank you very much for helping me with that. Any other questions for the health department individuals?
I have a question, Tony, but do we have any public members?
Just one.
Public members, you mean, well, that's what we're gonna do next, is open it up for public comment.
Okay. All right, well, I do have one thing. So all of the medical literature would say that the way to convince people to get vaccinated is, yes, to give general scientific information, but also to allow them to raise their specific concerns and address those specific needs. And so I'm wondering, I just would like to put it out there that I am more than willing to accompany the public health department. They're more than capable, but if you're going out to faith-based communities or various communities where there could be a translator, but to make sure that we address individual needs and people have a chance to ask questions. I don't know, I don't see that Jane is still on, but if we could have people send in their questions and devote one of the Fridays or one of the tape shows to the most common questions about, the vaccinations, now that we will have new updated science. So I just want to put that out there.
Well, I think that's a great I'm blank on the word I wanted to use, but great opportunity, but no, just a great thing for you to do to give back to the community. And I think certainly your reputation and your weight as a physician would help. I think most people, if they want to have a question and you're there to answer it, that's great. I'm not sure who's here. We probably have to go through Bobby, but I think
Kim.
I would be. I think they peeled off. Oh, there's Kim.
Nicole.
Nicole's here right now.
Yeah, I did want to mention too, I had mentioned that we're doing a listening session / conversation on the 27th via Zoom. And that really is the focus of it, Stephanie, because we had talked about that internally. So we're really hoping to, get a small group of people together, answer those individual questions. And we're hoping to have more listening session, but it's really a conversation. Hoping to have more after that, especially in different languages. We just want to see how this first one goes. But I can definitely talk to Jane when she's back on Thursday as well, and we can get something scheduled for TV.
And if you'd like me to participate on the 27th, I am available. That's up to you whether you think it adds or whether it's intimidating or whatever.
We do have Dr. Rama. She's already going to be participating, but our hope is to have
great.
A provider for each session. So we'll definitely reach out. We're going to see how this one goes. And then we'll reach out in the future, depending on a future session. So thank you.
Great. Does that answer it for you, Stephanie?
Yes, thank you so much.
Okay. Again, thank you for volunteering. Well,
Yeah, Kim, we can hear you if Kim was gonna just add.
Oh, go ahead, Kim.
I had just heard her say my name, so I wanted to chime in. We do answer a lot of questions, and we ask questions of clients when they come in. If they have questions, we ask, like, is there anything that we can answer that, what have you heard about the vaccine? What can we talk to you about? We try in a very, in a way that we're not trying to sway people, but we're trying to give them the correct information so that they can make the decision on their own. So we've done a lot of that in our outreach as well as in our clinics when people come in for different vaccines.
That's great. Thank you.
Thank you, Kim. Any other questions? Yeah. I'd like to open it up for public comment or questions. Not seeing anybody, but looks like no questions. I'm looking for motion to adjourn.
Yes, thank you.
Adjourn. Stephanie, adjourn. Okay, we're adjourned. Please, everybody have a safe and a happy Halloween. And of course, brush after all that candy.